We place a huge emphasis on technology. Technical solutions are equally as important as the overall design aesthetic. PNHS design buildings for people essentially. That might be healthcare, it might be mental health care, it might be housing, extra care. My day-to-day job involves finding practical and sustainable solutions to building designs. Technology addresses the practical solutions and legal compliance issues, sustainability, fire safety, and all of these very important aspects. With Foss Park, because that is a mental health care hospital, we try to make that a much more therapeutic and home-like environment while still maintaining a high level of robustness.
Foss Park is the result of a 4-year project to build a new mental health hospital in York. We ran over 70 design workshops with service users, carers, clinical staff to work out the configuration of the build as well as the interior design aspects.
As part of the technical design of the building, we used BIM software. The front of the building is very public facing, leading to a semi-public space and then a very private space for the patients. The observation of patients is incredibly important in a mental health care scheme. So on Foss Park, the building design with fingers coming from that allows that very easily to happen. Some of the key areas were the anti-barricade door design, the acoustics, the resin screens in the day spaces which break the area up, allow observation but make it have a kind of hotel foyer kind of feel. The screen's very lightweight, so we needed to work hard to provide a really robust framework.
Clear lines of sight, visibility at all times, lots of light, lots of green space and views of green space based on service users and carers' feedback of what it's like to be in hospital.
Foss Park was designed as a traditional building aesthetically, but needed to perform like a very modern building technologically. The buildings in York, there is a lot of gabled constructions with brick detailing, but obviously they were built traditionally, whereas this in effect is a skin on the outside of a structure. What we've tried to do is replicate that style, but with modern techniques. Brickwork detailing is very traditional, but it is supported by steelwork at the back of that. It was quite difficult to achieve that look technically and make sure it complied with all the requirements. Key with this building was that the client wanted access to all the plant spaces without having to disturb the patients. So we designed a roof space that's accessible, and all of the testing and commissioning and maintenance work can be carried out without entering the ward. The outcome on Foss Park was excellent. We wanted to provide a building that the client would be proud of, but also met all of their clinical needs, and I think we achieved that.
It's just absolutely amazing. What Foss Park gives us is a brick building which absolutely echoes permanence and safety, but has all of the modern attributes that we would expect. So our job in delivering safe care to people is absolutely possible here and was not possible in our previous buildings.
I think architectural technology can change the world. It's all the things in the background that make the difference to the final outcome on the building and the patient experience. We take that very seriously, and we're proud to do the job that we do.